I now have the great pleasure of introducing our keynote speaker for this convocation, Dr. Hanna Attisha. Every year we think very hard about who to invite as a keynote speaker, and we always try to find someone who we really think is a model for what public health professionals can be like. And I think, as you'll hear, Dr. Hanna Attisha is exactly that. In 2015, research led by Dr. Hanna Attisha confirmed the proportion of infants and children in Flint, Michigan, with elevated blood lead levels had nearly doubled since the city began using Flint River as its water source. After telling the story through data, she then told it in What the Eyes Don't See, her memoir of the crisis. It is an outstanding book. It's lyrical, disturbing, but ultimately hopeful as an account of how economic and political forces create poor health and how an engaged public can demand a healthier world. Graduates, under your chair, you'll find a copy of the book by Dr. Hanna Attisha. It is our gift to you. Dr. Hanna Attisha is also faculty member in pediatrics at Michigan State University, the founder and director of the Michigan State University and Hurley Children's Hospital Pediatric Public Health Initiative, a model program to help mitigate the effect of the Flint water crisis to safeguard the health of children in that city. On a personal note, I have long admired Dr. Hanna Attisha as a researcher, advocate, and writer. I am really delighted to have her here today, and I'm very much looking forward to what she has to say today. Graduates and guests, it is my distinct honor to call on Dr. Hanna Attisha to give the keynote speech at this year's convocation.
Wow, thank you, thank you, thank you. It is absolutely awesome to be with all of you today. Congratulations, graduates. Congratulations to family and to friends and to faculty and to absolutely everybody who played a role in celebrating this special occasion. Congrats, congrats. Thank you, Dean Galea, for inviting me. I'm really, truly honored to be with you today. And I am also truly hopeful. Grads, in a few minutes, you will get your diplomas. Important people up here will congratulate you, and you'll line up for one last time and file out. File out towards the rest of your life. You guys are totally on your way. Have you already packed? Have you guys already moved out, turned in like all your assignments? But you can't just flip a switch and light up the future so it's easy to see. Many of you will leave Boston, but your minds will linger here. You'll still be thinking about your classes and papers and friends and your professors. Maybe you'll hit the beach somewhere and snuggle up with Dean Galea's awesome new book, trying to figure out how to make people well. Have you guys read that? It's really, really an awesome book. There's even like Star Trek references in the book. It's fantastic. But slowly, slightly, your mind will start to turn away from the past and toward the future. This is the moment when your trajectory shifts from leaving to going. It's a powerful thing. There is lightness, a sense of momentum, excitement, nerves, hope. And I can see where you are going. Fueled by the power of this place, this engine of public health, you are the light that will illuminate some of our greatest and darkest challenges. Here, you received a quiver filled with arrows aimed at addiction, obesity, poverty, gun violence, inequity, and so much more. We have been waiting for you. We need all of you. You will be on the front lines of some of the most important battlegrounds today. Whether you know it or not, by taking on a life of public health, you have put yourself on overwatch. You are now the sentinels, the guardians, the avengers. Well, maybe not the avengers, but like almost as close and as awesome, but absolutely essential. Your responsibility is far-reaching, and it is as close to home as you can possibly get. This is the life that you have chosen, the life that we have all chosen. I chose to be a public health pediatrician. Almost all of my patient work was one-on-one, Small hands in mine, little ears in front of me, tiny noses to poke into, treating infections, but also trying to tackle those upstream inequalities and injustices. Treating what was in front of me, but also what my trained clinician eyes often fail to see or choose not to see. But sometimes the work you choose has other plans for you. And my life took a turn that I wasn't expecting. Instead of one-on-one, I found myself one on thousands and facing the dire needs of an entire community. And it is what I learned in public health: the epi, the stats, the policy, the practice, the environmental health, that allowed me to take a step back and look at the wider view. It was the public health perspective that made me ready to take on something bigger. For many of us, you can be drawn to the field of public health as a humanitarian, a mathematician, a statistician, or a health provider. It can be your religious calling, or it can spring from a love of pure science. For me, it's a combination of all those things, and maybe also a love of a little bit of suspense, because addressing a public health issue is a bit like solving a mystery, usually with just the right mix of instinct, insight, footwork, solid data, strategy, and pure luck. My story, the Flint, Michigan story, is about the unthinkable tragedy, as you all know, of people and their children poisoned by the most basic thing, our water. It is a story of what happens when the people charged with keeping us healthy and safe care more about money and power than they do about us or our children. In a corrosion of democracy, the state took over our predominantly poor and minority city and changed our water source to save money, all in the name of austerity. The water wasn't treated properly, making it about 20 times more corrosive than the water that we were getting from the Great Lakes. It was so corrosive that engine parts at a General Motors plant started to get eaten up, and they were allowed to go back to Great Lakes water. Yet the people of Flint were told to relax, that everything was okay. But it wasn't okay. For 18 months and more, this corrosive water leached lead, a neurotoxin, out of our plumbing and into our drinking water. It was preventable, but no one stopped it. It was avoidable, but it happened. It was all around me, and the signs were all around me, and I could not and did not see it until I studied it, until I knew it, until I knew it so well that I could not eat and I could not sleep, because then I saw it everywhere. Making others see it was a whole other thing. I ran up against people and entire systems built not to see, even when they did know. It was a blindness, an indifference, a willful ignorance to certain people, places, and problems. I thought the water coming out of my faucet was fine. I mean, how could it not be? I thought they were watching out for us, those anonymous people in lab coats with like test tubes and water meters. I thought they had their eye on things like air quality and water quality. And I was wrong. I was so wrong. And I learned something else too. I learned that I was responsible for the public's health. Me, Dr. Mona, taking care of sick little kids, an academic, a mom, a wife, driving my kids to Girl Scout meetings and soccer practices. No one else was coming. And no matter how hard and how scary it seemed, I couldn't close my eyes. I could only go forward. And I knew that if I was going to make a difference, I would have to prove through research, through science, through data, that our children were in harm's way. And I want to pause and reiterate how backwards that all is. My research never should have been necessary. Of course, our crisis never should have started, but it should have ended when the first mom held a jug of brown water. It definitely should have ended when we knew there was lead in the water. But it never should have gotten to the point where the blood of our children had to be used as detectors of environmental contamination. To this day, health officials and policymakers continue to demand proof of harm before taking action, be it for lead or PFAS or endocrine disruptors or anything else that is not supposed to be in our environment, nor in the bodies of our children. This industry-driven philosophy persists, and it is fundamentally at odds with the public health pillars of primary prevention and the precautionary principle. And all too often, this disproportionately burdens our most vulnerable populations. It is a social and environmental injustice, and in Flint, that injustice only widened. And even as I offered that scientific proof, that proof of harm, my research was met with denials and attacks. And for a quick minute, I regretted using my voice. I was scared, I was sick, I felt like this big. I began to second guess myself. And I thought maybe I should have just closed my eyes and stayed quiet. But that was quickly replaced with the realization that this had nothing to do with me and everything to do with my kids. It was also a recognition that every number in my research was not just a number, it was a child. It was about Tyler, who sprained his ankle, and Sasha, who always asks to use my stethoscope to listen to her heart, and Jalen, who had pink eye, and Jasmine, who at her 4-year checkup, when I asked her what she wanted to be when she grew up, she said she wanted to be 5. It was about all the Flint kids I knew and saw, all the kids I'd ever known and seen, and all the kids that I had yet to know and seen. It was as if they were jumping out of my spreadsheets, pulling me forward, lifting me up, and giving me courage to speak out against a system that wanted me to stay quiet. And this is an important lesson for many of us that live and often get lost in big data, in population-level data. What do your numbers mean? What will you risk for them? And it finally took a while, but it was through our persistence, our teamwork, and our science that we helped expose this man-made crisis. And within weeks, we went back to Great Lakes Water, and since then, we have been building and sharing our model public health recovery. And today, I find myself in Flint working in a place that is defining how a city heals and protects itself. It's kind of a ground zero for public health initiatives. It's a place for new ways of thinking, born out of the need to soar out of the downward spiral of our past. Ignoring science was a cause of our crisis. Embracing science was how the fight to unravel the crisis was won. And we are now leaning on the emerging science of child development and brain plasticity and trauma and resilience to mitigate the impact of our crisis. Framing this crisis, which was more than just about lead, we had a Legionnaire's outbreak, skin issues, but basically a community-wide trauma, a loss of trust. And this was on top of a population already rattled with so much adversity. And incredible science has taught us that when children are exposed to trauma, especially repetitive trauma, it leaves lifelong scars, like developmental delays and chronic diseases and decreased life expectancy. So we are building that resilience through evidence-based interventions, things that all kids need, like home visiting programs and high-quality childcare and Medicaid expansion and mental health services and nutrition support and parenting and breastfeeding support and so much more. And I am not naive to think that kids live and grow in isolation. We are working upstream on the harder to see things that kids and families and communities also need to be healthy. Things like poverty mitigation and economic development, participatory democracy and self-determination, and restorative and environmental justice. We are doing everything that we know how to tip the scales, and it's all being done together in a respectful, collaborative, and partnered, community-driven, and trauma-informed way. And I love to borrow this line from Frederick Douglass, an abolitionist. 150 years ago, he said, "It is easier to build strong children than to repair broken men." And I think it sums up why so many of us are in public health. It's all about prevention and promise and potential. And in a very data-driven way, we are not only working to improve public health in Flint, but we are also hoping to shine a bright light beyond Flint. There are so many ripple effects of our crisis. We have raised the nation's consciousness on the broad issues of drinking water safety, the lingering legacy of lead, deteriorating infrastructure, ongoing environmental injustices that disproportionately impact the poor and minorities, and the consequences of science and fact denial. But most of all, the story of Flint shines a light on our civic responsibility and our deep obligation as human beings to care and provide for each other. And as much as the story of Flint is a story of a crime committed with absolute indifference against some of the most vulnerable people in this country, it is also a story of how everyday people, moms and pastors and activists and journalists and scientists and students, people just like me and you, came together and said, "We've had enough," and took action. It is a story of academics walking out of the comfort zone of our institutions and into community, working hand in humble partnership to challenge the status quo. And it is a testament to the idea that individuals working together from all walks of life and all disciplines can absolutely make a difference. In some ways, the Flint story is really a playbook of resistance and hope. And that is a story that we all need right now, and that is why I'm here sharing it. Because the story of Flint is not an isolated story. There are kids everywhere, from the Rust Belt to rural America, coal country, black, brown, white, waking up to the same nightmares. The nightmares of poverty, injustice, austerity, lost democracy, and stolen opportunity. This is all happening now, and it all impacts the health of our communities, filling our hospital beds, dropping life expectancies, and deteriorating our public's health. And this is where we need you. Your work is about standing on the front lines every single day, holding those lines against sickness and disease, and holding those lines against inaction and apathy. Today, this is especially critical because our work is unfinished and quite possibly more important than it ever was before. Because vaccine denial is a public health issue. Racism and hate and nationalism are public health issues. Guns are a public health issue. Controlling women's bodies is a public health issue. So is inequality, paying people a living wage, attacks on immigration and putting children in cages, climate change, poverty, and lead, unfortunately, is still a public health issue. Perhaps one of these issues drew you to this field, to this place in the beginning. And these public health issues are huge and they're global, but they are also right outside our front door if we choose to see them. Even here in Boston today, a large toxin-emitting and explosion-prone gas compressor station is being proposed in North Weymouth, just 9 miles from here. It's another example of an economic, racial, and environmental injustice that will impact all of our health. We need you. The integrity, vision, science, and activism of the public health workforce is imperative to fix these critical problems of today. And when you do leave here, really leave here, I know this is where you will be going. I urge you to use the tools that you have learned here and the tools that you will continue to acquire to keep your eyes open. I urge you because I believe in you. I believe in each of you. Let your clarity of vision and your broad public health perspective show you how the world should be, not the imperfect place that it is. One person with measles is bad. Hundreds with measles is an epidemic. One kid with lead in their blood is terrible. Thousands is a preventable tragedy. One child shot in what should be the placental safety of their school is sad. When thousands are shot and die in our schools, streets, dance clubs, workplaces, shopping malls, places of worship, then this is a national health emergency. And instead of turning this innocence into nonchalance, you must turn it into awareness. And then don't keep it to yourself. You must take action. From this day on, you are entrusted to be the voice of health. We are all depending on you. And we need your many varied voices. Inclusion and diversity are a critical part of all of this. It will open our eyes to different problems and different solutions, with the benefits of this work reaching more people and more places. And when we do all come together to combine our many different voices, we can each be a piece of the answer. We can each work to solve the many problems that are around us today. And then, only then, we will see what we have yet to see. A public health future where the trajectories of our children are not bound by zip code, state of birth, color of skin, gender, school district, drinking water source, parents' income, religion, nor country of origin. Let us work together towards this healthy America, a place where eyes stay open, a place where we stand up for what is right, no matter how hard it may be, and a place where equality and opportunity and our public's health are once again encouraged and advanced. You guys with me? This is what our job is, and that is why we are so proud to do it. Welcome to that public health family. Congratulations. Thank you.